And this is, I think, the company deserves all credit for not only developing the drug, but also doing a lot of trials. And now, as we heard from Dr. Arun Sanyal, Saroglitazar is now being tried even in the US. Advanced trials are going on, and I understand that they're even waiting FDA approval for that. And if it comes, it will be the first drug made in India which has got an FDA approval. I understand that they're already in advanced stages of applying for that. In relation to hypertriglyceridemia, now we did have drugs earlier. We had earlier with gemfibrocil, then we had fenofibrate, and we had generally the fibrate group which was used for triglyceride lowering, but they're relatively mild. And when Saroglitazar first came and we started using it for lowering triglyceride and in the process also raising the HDL, which as you know is very low in Indians, I found remarkable effect of this particular drug. And it's fair to say that I don't think even the fibrates can match Saroglitazar. It's probably because of dual agent and the way it is structured. So the amount of triglyceride lowering that we see with Saroglitazar is something I have not seen matched by any other drug. And in that sense, we are very proud that an Indian-made drug is very effective. For those of you who listened to Dr. Arun Sanyal's fantastic talk today, really fantastic oration he gave, he very beautifully, he didn't just talk about liver disease. He talked about the whole of metabolic diseases linked to liver disease. And he called it as a very early stage, and then the next stage, and then the clinical stage, and then the irreversible stage, where the liver then dominates and then it's downhill course. And he made a strong plea for reducing the fat and reducing the triglycerides, because if you do that, then the body doesn't get flooded with too much of the free fatty acids and the excess fat which comes out. He showed beautifully that up to a certain extent it can get metabolized in the muscle, but beyond that it can't. And then it kind of accumulates in the adipose tissue and also goes into the liver. So that's the kind of starting point as far as the whole metabolic process is concerned. So I think rather than waiting for a very late stage, if we have drugs like Saroglitazar which we can, because we always think triglyceride is not useful. There is a lot of, if nothing else, it will prevent pancreatitis. So whether lowering triglycerides will prevent heart disease has always been a question. We heard Dr. Shobha Shivaprasad talk about how these class of drugs and fibrates are now being used in retinopathy treatment. So it's not just for dyslipidemia. For the application is much wider, and therefore I think this is a drug which and in all my years that I have used it, I have not seen any side effects, which is another thing, that as you start using these drugs, then you start getting all kinds of side effects. So it's absolutely safe drug. Seems to be a very powerful triglyceride lowering agent, made in India drug, which is now slowly getting acceptance in the world. So why should we hesitate to use that? So I use it quite extensively in my patients.